Right. Promoting, aim it to panelists. Good morning or good afternoon, good evening. One of those things. Awesome. Yeah. There we go. All right, sweet. How are you tonight?
Good. How are you?
Good, good. Tonight we're going to do a pretty cool one on the hip, which would be very cool.
Awesome.
So, yes. I got a couple things that are kind of cool. So I had a patient this week. Tell me about something. Do you do a garden yet? Do you do
Yeah.
one?
Yeah.
Okay. So you know the black covering that you put in between. Some people do that in between rows.
Yeah.
You know, there's a more expensive one that I never even knew existed.
Well,
A
like,
little pricier, but
okay,
it's thick. It's actually called garden carpet.
oh,
And so one of our patients that you know, if I say her name, Vanessa is her name,
mhm.
but she worked at a greenscape place, and I ordered a bunch of it, and it's so thick, it like has a carpet type ground, like it like lays right on there,
Yeah.
and nothing can grow through it. She's
Wow.
she's used hers for like 4 seasons in a row, easy. So she
Dang.
put it up, and then I'm like, what? So I just ordered it. Ours is it's a little too much. We'll see how it turns out, but it looks pretty good so far.
Cool.
Yeah. So
Nice.
I know it'll be good. So tonight is about the hip, but we're going to take it at a different approach. And our first thing is to go over some cool things that I found. And I'm going to harp on this for a long time after this one. This is one of the articles that hit linoleic acid, which is one of those bad fatty acids that we hear about in cooking oils. So vegetable oil and seed oil is really the bad ones. Think deep fried anything, right? So all those types of oils lead to this thing, and they're thinking in terms of how much it's used in our society. It might be the number one reason for chronic disease in the United States currently.
Wow.
Beating the thing that I thought was bigger, sugar, processed sugar.
Yeah.
Because it messes with so many things, like in the process of fat, getting rid of fat, burning fat, doing all those kind of things. So not only can it help you, like, if staying away from it can actually help you burn fat, it will, it's just terrible for you in the cholesterol department, all that stuff.
Yeah.
So here's some alternatives. So butter, just straight organic grass-fed butter, is one of your best alternatives. And by the way, once you go that way, it's so much better than anything else.
Really?
And people, yes, that's what chefs use all the time. They use
Yeah.
butter.
Yep.
Try lard or butter cooking bacon, dear Lord. That, I mean, just the idea of that sounds like so cholesterol, but it's wrong. It's really good for you. Coconut oil is really good. Coconut oil. G, if you've ever heard, I've never used to have the G or the G butter. It's a G.
Oh, yeah. I just saw it at Aldi the other day and almost bought some.
Oh yeah. Oh, I got some good news also. I forgot about that. There are fermented pickles, truly fermented pickles at Meijer's. The patient. So Amy knows this, but we've been working with we've been coaching a couple people in the herbal thing. We're hoping that keeps growing. I just love it. This lady it's been super awesome to like watch her entire process. What I love about it is our approach is so much different because we're going after, every aspect, and we're going to constantly keep monitoring as it goes. And she's just done fantastic. So when she took on the challenge, I'm like, if you can find fermented pickles, then go for it. But I didn't think she'd be able to find them, and she found them in an hour.
You remember the brand?
Oh, good question. Ooh, let me look real quick.
Okay.
Because we're so excited. It's me and you are so exciting anyway that
I know.
one of these times I'm going to learn on the beginning of these. Oh, there it is. Oh, it is called Bubbies. Bubbies.
Bubbies. Okay.
Yeah. Poor this patient up top. Well, I can tell you her name. Poor Beth. She's going to be mad because we'll probably suck that out of there because, man, fermented pickles are my jam. I would love that. I did fermenting, and we'll go into that in our 1% tribe again, obviously, because I love it. But fermentation, so good for you, like with the probiotics and those kind of things. But it's also fun to do. Like most of them are pretty. It's kind of cool. Like once you get there, you're saying, look how much you made in just chopping vegetables, chopping vegetables and mixing around a little bit. And now you have all this food. So if you could find stuff that makes it's a really nice way to, prep anything like that. So, and then there's one other one. So it goes grass-fed butter, coconut oil, ghee butter, and then the lard that I was talking about, like a nice organic, let's say saving the fat off of something you cooked. And tallow, which I've never used either. So tallow is TALLOW. That one is a pretty good one as well. And so that's my first one, staying away from those bad fatty acids, because that's what's crushing us in a lot of different ways. And so hopefully we will just get on with seeing if I can do this on so I can look at the Facebook Live on my phone while we're going. Because, there it is. All right, cool. So I'll stay right in there. Cool. So then I can see the comments. I'd love, I had a few last time, so I want to make sure. And I haven't sent our Father's Day one up. But, okay. So my next thing is coffee. Coffee is actually a huge increaser of metabolism. And, of course, you got to think I'm talking straight coffee. I'm not talking with all the stuff in it, right? So trying to get as black or organic as you can with the taste of coffee. I'm a straight black coffee guy. The beans make the big difference for me. But huge in increasing your metabolism, and it's just like anything. If you take if you get too much, I find myself doing that. 2 or 3 cups of coffee in the morning is probably a little overkill, but having that caffeine is a good increaser of metabolism. So here's a cool one. I thought this one was awesome because I had a patient, we talked about it this week because they didn't believe me. And then, so high cholesterol, high blood pressure, right? So a lot of times the only thing you think about is the drug or, those kind of things. But there's huge evidence for a couple different things. And we've gone over them before for cholesterol. Cholesterol is really a stress reaction. It's a stress reaction of something. So if you have a high stress environment let's say live in a high stress environment, that's one way. So a lot of my patients or people that I'd even known have had success just meditating, learning to meditate. It's quieting the mind. I've seen them drop 20, 30 points just in that ability to do that, and so one other one was blood pressure. And they did a study on, if you go back to our videos, I think we did one on just breathing with Dr. Andrew Weil a while ago. That would be a good one. Breathing, making sure your magnesium is good, and then a couple herbs was it drastically reduced blood pressure. So learning how to do a slow, deep breath. There's a ton of different breathing techniques out there. A lot of yoga style breathing is good. just to learn how to do that. Inhale through the nose, hold, exhale, right? So we've gone over those before. So breathing, magnesium, and then these herbs. So basil, thyme, cinnamon, or turmeric. They all have one thing in common. They're all anti-inflammatories. So there's like 24 herbs you could add in there. Any that we've talked about that were anti-inflammatory in the past could be a one that you do, but that's a easy try. If you have high blood pressure, maybe you try that prior to getting on a drug that may ironically leach your magnesium so that you have muscle cramps at night, and then you don't know why, and then you have to come to me, and then I say take magnesium, and you're like, that worked. Well, the reason it worked is because we know a lot of those medications will leach that magnesium out of your system, and that's one of the major issues that we're having. So those are two, and then another. I don't know if we did. I saw this article, but so nutrients that fight depression. This is kind of cool. So think if you get into those lulls, right, down or whatever, those kind of things, making sure that you have this in your diet, which is great because it's going to be a lot of it's vitamins, which is easy to do. And most of your green, like the darker green vegetable you get, and the more you eat well, the more you're going to get all of these things. So the list goes, this is kind of a long list, Amy, if you're writing it out. So folate, iron, the good fatty acids, right? So from fish, all the different flax seeds, those kind of things. Potassium, selenium, thiamine, vitamin A, B6, B12, vitamin C, and zinc. Dang, that was a long list. But nice thing is, if you take all that stuff, you're probably not going to get the flu either. So that's a pretty good trade-off as well. So those are the four I kind of came up with this week. Next week I'll probably be off unless you want to see my bib around my neck with the lobster in my hand as we're doing it. I don't know.
Not really. Not really. We don't want to see that.
All right, fine. So there's the four. Just remember that. Try to change your oils. Try to change your cooking oils. Vegetable oil is one of the worst. So, and they sell it in gallons. So just remember that as you're cooking. All right. So let's talk about the hip. This is going to be kind of cool. I got a different analogy for the hip. We're going to start by we have to understand. So the hip is a very big joint. The one thing that we have to really go into is why so much bone-on-bone arthritis in the hip? If you start going, well, why? That's what I want all of us to understand. Like when we get into the 1% tribe stuff, we're not going to ask, oh, I got bone-on-bone. Well, why? Okay. Well, in my brain, I go, okay, that means, is it genetic? Well, we've talked about that. It doesn't have to be genetic. You can change your genes at any time you want to. We got that. Maybe it is a program that you learn to walk weird or different, or in a walking motion that would create that. Well, okay. Well, why would that walking motion create hip arthritis? Well, maybe your mechanics of your feet aren't working correctly. Okay. Well, maybe why aren't the feet mechanics working? Maybe your low back is not in the right proper alignment where those nerves aren't flowing correctly. So you can see how many different whys there are to a hip joint that is so powerful. That thing is almost as big as your fist, right? So when you have this big, huge fist, and really tight joint around that. And you'll see in one of the things, it's got a limited blood supply. So what do we do to protect that arthritis in that area? So one, oh yeah, she pulled out the book. She knew it. I was going to ask anyway, but I'm going to show you a little physics piece because I'm a nerd. So I want to show you this piece. It's like a 30-second thing. So I'll show you that. And then let me get to it. Oh, come on. Get out of the way. All right, hang on. Oh, there it goes. This one. Okay. All right. We're going to go through this real quick. Okay. Now we're going to come back right about there. Okay. So as you see, you have the spring. The spring, inside the spring is what we would call potential energy. Okay. So in that spring allows that energy to be given, right? At the ends of the springs, you can see how it's compressed down to where there is no potential energy. Does that make sense so far? Pretty simple concept, but here's what you don't understand. A lot of us don't get about the leg. One of the problems is like when we start losing the energy, the potential energy within our joints are all designed, and our entire leg, you have to think of your leg in terms of, the entire structure. You're talking muscles, bones, ligaments, they all have to do this. And what they're trying to do is when we're born, we have this nice potential energy spring from our foot all the way up to the top of our hip. Does that make sense? Now, as we start to, let's say, age, maybe get weaker, those kind of things, that potential energy goes down and down, right? So if I have a spring with potential energy in it, and I have a spring next to it that looks kind of like, so if I cut off this piece, right, and it just gave you a spring that was close like that, which one do you think would rust faster? You didn't know you'd get on there. You didn't know you'd have a quiz. So the one with no potential energy or the one with a lot of potential energy? Which one would
one is going to rust first? The
Yep.
one with no potential energy.
Good job. Because there's no potential energy. They can't get away from each other, right? So the rust is just those two having to collide. Now, think of in terms of like how our hip, our joints, all of them. What do we hear every day, Amy? Bone on bone, bone on bone, bone on bone. Why? There's no potential energy left. Where do we get our potential energy? From our muscles and our nerves and all the other pieces other than the bone. Does that make sense? Mm-hmm. So the whole mechanism is based on having this leg be as strong as you possibly can. The biggest mistake people make is they think it's a tight something. It's a weak something. That's really what the actual problem is. Like as people go, a good example, you work 12 hours on a factory floor for 35 years. You've lost a ton of potential energy because 12 hours a day, you're not like building your leg strength. Eventually, in a 12-hour time frame, your potential energy squeezes all your potential energy out. By the end of the day, it's done. Okay. So really, a lot of times the idea, and so like after work, that person, like, how do you gain back that potential energy? Is that making sense?
Mm-hmm.
Makes sense in my nerd brain, but it's like but a lot of times that is one of the keys to understanding why the hips, why the knees happen. And it's on my, for my hardworking people all the way up, right? So you have these hardworking people that are on their feet constantly all day. Well, what happens there? That balance of not resting properly either starts causing you some major problems that way. So let's go into the anatomy of, let's see. Don't want to go into a big, this one was pretty good. I don't want to keep us on this stuff.
This is why she wasn't.
Hang on.
Here's why you can't outrun a
I
bad
probably
guy.
could get uncheap and like skip ads. All right, let's go to there. Okay.
Socket portion of the acetabulum in the pelvis. The cartilage is especially thick in the upper and back part of the socket, as this is where most of the force occurs during walking and running. Ligaments are soft tissue structures that connect bones to bones. There are several important ligaments in and around the hip. Surrounding the hip joint, the joint capsule is formed by a group of strong ligaments that connect the top of the femur to the acetabulum. A joint capsule is a watertight sac that surrounds a joint. These ligaments of the joint capsule are the main source of stability for the hip. They help hold the femoral head in place in the acetabulum or socket. A small ligament connects the very tip of the femoral head to the acetabulum. This ligament, called the ligamentum teres, doesn't play a role in controlling hip movement like the main hip ligaments. It does, however, have a small artery within the ligament that brings a very small blood supply to part of the femoral head. Tendons are soft tissue structures that connect muscles to bones. A long tendon band called the iliotibial band runs alongside the femur from the hip to the knee. The iliotibial band provides a connection point for several of the large hip muscles. A tight iliotibial band can cause hip and knee problems. A special type of ligament forms a unique structure inside the hip called the labrum. The labrum is attached almost completely around the edge of the acetabulum. The shape and the way the labrum is attached create a deeper cup for the acetabular socket. This small rim of cartilage can be injured and cause pain and clicking in the hip joint. The hip is surrounded by large, thick muscles. 3 gluteal muscles, the gluteus minimus, gluteus medius, and gluteus maximus, make up the muscles of the buttock on the back of the hip. These muscles extend or pull the thigh backwards and abduct or pull the thigh away from the other leg. These muscles are also important for keeping the pelvis level as we shift the weight from one leg to the other during walking. The inner thigh is formed by the adductor muscles. The main action of the adductors is to pull the leg inward toward the other leg. The muscles that flex the hip or pull the thigh forward are in front of the hip joint. These include the iliopsoas and the rectus femoris. The iliopsoas muscle is a very deep muscle that begins attached to the lower spine. It travels out of the pelvis to connect on the inside edge of the upper femur. The rectus femoris is one of the quadriceps muscles, the large group of muscles on the front of the thigh. There's also a small, thin, strap-like muscle called the sartorius muscle that runs from the pelvis across the knee and connects to the upper tibia just below the knee joint. Several small muscles travel from inside the pelvis across the back of the hip joint and attach to the back of the upper femur. These muscles help to stabilize the hip joint and rotate the leg outwards. Together as a group, these muscles are called the external rotators of the hip. Finally, the hamstring muscles run down the back of the thigh. These muscles originate at the bottom of the pelvis. Because the hamstring muscles cross the back of the hip joint on their way to the knee, they help to extend the hip, pulling it backwards. All of the nerves that travel down the thigh pass by the hip. The main
I won't kill you on that part, but dude, did you see all those muscles in there? So the muscles that are there, there's tons of nerves that we can go through in this as well. Sciatic nerve will be next. You know, you get the femoral, you get a lot of those different ones. Arteries go through there, But the key is to understanding is look how powerful and how many muscles you need to make sure that our spring is not touching each other, right? So if you go back to that spring mechanism, the reason those muscles are there is to make sure that that space isn't on top, like isn't grinding away, as it goes. So one of the things, that's why a lot of times people get huge results with like chiropractic, just alignment, with massage therapy, with laser, all those things, because you're going after a lot of the muscle or the nerve to the hip, and that's why people for years have had good luck in, like, let's say their arthritis is real bad. I had one guy, I'll never forget it. He came in just for the sole purpose of not having a hip replacement. And me and him had like a running joke that, as he's getting adjusted, and I'll show you why that is too. We didn't even adjust his hip actually on him. We just made sure his spine was working correctly, because you could see that just from the picture on your screen, you can see the nerve. I mean, it's all from that lumbar area. So we'd adjust his spine, his nerves would work good. It would go to those muscles, the big giant muscles in there, and it would last. So we had 6-7 years before, he even had to think about doing a hip replacement type thing. But tonight is about making sure that we hopefully never have to get there. There might be a situation where you end up getting there where you have to have a hip surgery or whatever. But if we start taking care of our legs the way we should, and make sure that spring action, that potential energy is in your body at all times, you're going to be much better off. And so making sure the muscles of your legs are taken care of in a big way. That means like what we talked about with the foot and the knee, right? How to walk, how to make sure your knee is correct. All of those will lead to really good hips that you don't have to have anything done, right? And so the big thing is to understand what your goal is as a person is strength of your legs. Like every lady that comes in, she's like, what exercise should I do for my low back? And I say, I don't mean this personally, but if I had a world of ladies with, there's two weight things that I'd love to see: strong legs and your shoulders like strong as an ox. Those two, if you just did those two weightlifting regimes, during a week, you would be sitting so good. Because why would you have degenerative arthritis? So think about this real quick. We'll get out of this real quick. So why would you have degenerative arthritis in the same place that you have osteoarthritis in some people? Because the muscles aren't working as good as they used to, because we have too many sit down situations. Why do old ladies and old men's hips break? Because they sit so much, right? So they lose that muscle mass within there. Those legs are not strong. And that is what we have to fix. So those are a lot of the things. It's like staying on the strength. The hip will always be fantastic. There are tons of ways to fix. Amy and I know, I've been so excited about this like laser situation that we have now. We've been blowing that up pretty good. If somebody has like the hip inflammation or those kind of things, it's a game changer for that. But tonight is about learning how, and it all starts for me. The next guy that we're going to show is, it all starts for me about understanding your mechanics, even down to your feet. Okay. So like today, I'm getting used to it. This is my first year doing it because of this 1% tribe stuff. I've been barefooting it a ton. So it's kind of awesome, actually, like to get used to that. It's wild. Like the first day, and then like my little wussy feet. And then you get out there, but I was out in the garden today and just doing all that stuff. It's like you should have been doing it from the beginning. It's absolutely totally different feeling, you know,
Mhm.
doing all that like out there. So what I would say is start with the mechanics of your feet. Make sure, like a good example of this that I like to think of your potential energy and why jump roping is so important. How many of us after the age of 20 jump rope anymore? You know, that's just that little tiny jump allows you to re-engage your potential energy of your lower leg, at least, if not your upper leg, right? So you have all of those actions that'll happen in there. And that's why it's so important to make sure you understand how to jump, how to do that. How do we go from like Jess is on tonight, but how do you go from a 60-year-old that can do 3 back flips, and then we get out, work 10 years, and then all of a sudden we can't even jump like anything, right? So that is a big deal. That is those type of things. And most people with hip problems, they wouldn't even dream of like having me go, okay, go home and jump rope. You know, that would be a hard thing, you know. And but that's an ultimate goal that I would say, go grab a jump rope and try. You know, it wouldn't hurt. We get 10 in, it would be good. Now I'm going to show you this one last guy. And then let me see. I really like his stuff. I probably would tell all of us to get on his, like, subscribe to his channel. Not this guy.
And siding.
That's boring stuff. But if you're a nerd, go keep watching. But his name is
The thigh is pointed.
grown
How are you
and healthy.
more than you think?
Actually, I'm not subscribed. I'm gonna
This
subscribe.
is Grown and Healthy, the channel where we explore self-improvement through movement. Now, when walking or running, it is very important how our legs can go back behind us. A lot is dependent on our range of motion in our hips, ankles, and feet. And your restriction may be the limiting factor in your movement options. There are infinite actual variations, but most can be split into one of these 3 categories. First, the neutral way. This is when the foot sort of goes straight back and the thigh is pointed straight forward the whole time. This way is not as common as you think. And people who think that they are actually performing a neutral step path will find that they are not. Once they review recorded footage of them actually in their gait cycle, we often misinterpret what our bodies are actually doing from lack of interoception, which is a skill in itself. Next is with external rotation. This is when the foot goes behind you, but the thigh rolls externally as the foot and leg go under and behind your body. This can rotate the foot inside the shoe towards the pinky side, the lateral edge, with each step, and will place more pressure on your medial arch, leading to symptoms like hyperpronation. You combine this with narrow shoes, and that will equal bunions. For most people, this is a developed habit and not innately how our mechanics work. We have overridden our movement code with influence of our culture. I mean, just think about what footage comes to mind when you think of a cool person walking. Things like man spreading is just disengagement of your internal rotation.
I didn't see that part of it. That's funny.
While ruining our capabilities. We all want to look cool and to belong for survival purposes. I understand, but we do that by mimicking patterns thought to go along with the current norm. Along with wearing the current normal shoes, this ingrains a limited range of hip internal rotation. Long term, this can ultimately limit how much your leg can actually travel behind you, as external rotation has a limit in the motion. As the femur goes behind the pelvis, it is closing space between those bones, whereas internal rotation has almost no limit because it pulls the femur away from the pelvis, in between those bones. You'll often see this position of internal rotation in a forward split. Next is internally rotated. This way is when the foot goes behind you and the thigh rolls internally as the foot goes back. This is ideally what we're looking for, as when it's combined, With the joint movement of the ankle, midfoot, and big toe working in unison, as they should, the leg can go back behind you to a larger degree, not only providing more stability, but also a longer follow through, producing more force emitted from our end range hip extension. It also helps peel the foot off of the ground while splaying the toes further apart, rather than jamming them together when you are externally rotating. Notice the difference in my toe alignment on push off in these 3 different patterns.
I'm gonna skip a little bit.
Patient. Your pain sitting, running, squatting can all be traced back to the lack that you have in internal rotation. And if you are 20 something who doesn't think that it's a big deal right now, this dysfunction will catch up to you eventually. I mean, I'm 44 years old and I sprint at the track on a regular basis. Yet I rarely see people in their 30s sprinting.
That's a true statement. So one of the biggest things I'll tell people is, and we just had we've had a lot of good, had a patient, loves to run, didn't do running during, because she's a teacher, likes to run during the regular, in the summer, doesn't do a ton of running outside, was having some issues. I made her do 10, one of the best, easiest ways to get your mechanics fixed, as quickly as you can, is to sprint. And it's hard neurologically in our brain as we get older. It's really, really tough. I'll probably leave this at that because I think we're good. You saw all the different ways it could happen, right? So yeah, he was getting a little complex there, but that's okay. Yeah, so I think that's all the videos I got. But yeah, a lot of times learning to do those things we did as kids, like normal, sprinting in the backyard, making sure that's the dedicated piece to what you're doing. That is one of my favorite things. Now I got to figure out how brave I am to do the barefoot sprinting. But at the same time, oh, that's amazing stuff. When I get into that realm of how you feel in general as well, just getting out and there doing it. But mechanics, like you can teach yourself, and that's what 1% is all about. Like, find that hallway, at first in your house. As soon as you get into that hallway, you're gonna heel, side of your foot, toe off. And not only are you going to help your feet, you're going to help your knees, you're going to help your hips as well. And so you start walking that way. And here's the crazy part. You'll actually start improving your lumbar vertebrae as well. That's all connected. And so once we are able to do that, you may not, fall out of place as much, those kind of things. So Amy, what is our mental connection to the hip area?
Sorry, gotta fly.
Oh God, I know. I had one today. Dear Lord, that was a crazy rain. It was like rain, and then it got hot. I was like,
Yeah.
oh, that was steamy.
It did. All right. So there's lots of, there's hip disorders. I'll just talk about hips in general.
Yep.
It says they hold my body in perfect balance and are located between the pelvis and the femur. I lean on my hips. My hips enable my legs to move in order to make my body move forward. They determine whether I move forward or not. They represent my basic beliefs about what my relationships with the world are or should be. The hips contain my positioning about living, either based on myself or based on others and how they perceive me. As the pelvis and the hips form a whole, they represent my striding forth in life. The hips, therefore, also represent my level of determination for advancing in life.
That's awesome.
And then it goes into, different hip disorders or whatever. But
Sure.
there's a few parts that stood out. One says, this may originate from a situation where I felt betrayed or abandoned by someone, which affected me so much that I've been calling into question all my relationships with others. So
I really
lots of
like that.
interesting things.
Yeah, there's a lot like moving forward in life. When does people have hip problems? a lot of times, if I had to guess, that has been doing this 23 years, is when you retire.
Yep.
And that if you think of that as an emotional thing, like as a mental thing, all of a sudden
Yeah.
I'm changing, I'm going forward in life in a different way, and I don't know, maybe I don't know what that looks like, and so there's so many different places we can go with that too. Sadie, hi baby.
You wave by.
You didn't even say hi to me last time. Oh, so tough. This summer, though, we're going to go to the beach because I am sweet at sandcastles.
Oh, where did we go yesterday? We went to the beach yesterday all day and we all got
What?
fried. We reapplied sunscreen, but it didn't matter. We didn't
Where'd you
do it.
go? Where'd you go?
We go to Tiscornia Park. It's in St. Joe. It's
Yes.
across from Silver Beach, kind of across the pier. It's really nice.
Oh, yeah. It's one of my favorite. We've gone to everyone. So here's something you can do. This is what we did as kids. You do not have to do it. So we took a whole summer and we kept going to different beaches. And then we'd make the sandcastle and then put the name of the beach in front and then take a picture of it before it died.
Oh,
You-
fun.
Yeah. So we have that in a book. Like we just every weekend we'd go and
Yeah.
Allie and Lexi were that age. And we
Yep.
just take off, build the sandcastle, and then put the beach name in front of the thing. And then it would die. And then, that kind of thing. But that was
Yeah.
fun. Oh, and it's only, we're kind of spoiled here. It's not too far away, actually.
No.
It's like, it's much closer than, sometimes it feels it's like, oh, we should go, So that was awesome. But do you have any questions on that? And I think that was pretty good. I think hips
Yeah.
are tough because they come.
Yeah, it is. It's hard because a lot of people feel like when they start having low back problems, hip problems, whatever, they feel like they're going to have hip surgery when in fact they don't necessarily need that. A lot of times they just need to strengthen their muscles and stretch. Oh my gosh, stretch.
Yes.
And then they start
Yeah.
feeling better,
Yep. And understanding where they're losing their energy, right? Their
Yeah.
potential energy in that leg. Figuring that out is such a big deal. And the hard part of hips, a lot of times when you start having major problems, or somebody sees x-ray bone on bone in knee or hip, that means you beat it up pretty good for a lot of years. And so one of the hardest things is the patience to reverse it, and that's where some of my most successful people are just people that are petrified of surgery, to be honest with you.
right?
Like some think surgery is the best thing ever, or, and they go a little quicker. It can take a long time, and that's, you're talking a hip. Think of how far away from the ground it is. And what if the ground, let's say you walking incorrectly, was the reason it happened, right? And so that takes years of that. Or if we go into the mental side, how many years were you always afraid to go forward, right? How many years deep is that? It could be right away. It could be a year, but it definitely is something. But so our 1% this week, try a little bit more of that barefoot stuff. Go get a jump rope. That would be kind of cool. You can feel that potential energy once you get rolling on that. That's a pretty cool thing.
It's a lot harder. It's a lot harder than you think, and it takes a lot more coordination than you think.
Oh God. Yeah. Don't hurt your face. Just don't hurt your face. You're going to hurt your face. You're gonna break your nose. If you come into our office with a bloody lip, I'll know exactly who's my 1% tribe. And I'll
Yep.
give you. No, I'm just kidding. Yes. So we're excited. Thank you guys for doing this. We'll probably be not here next week. Maybe the week after. We'll see, because I can't remember if I'm timing this right, but I appreciate you guys getting on. Oh, Jess, you have any questions? Let me see if I can, before we let everybody go.
Mom's here with me. We were 1%ing and walking while we listened.
Oh, sweet.
Yeah.
You sprint
Uh,
while you were listening? I'm just kidding.
We didn't sprint. We had already stopped our walk by then, but
Okay. That's
I don't
awesome.
think we have any questions, but lots to think about here and lots of good information.
Awesome. Yeah, I cannot wait. It's it grows each day. I got some some other exciting stuff I'm hoping once I get back from vacation, we might be able to make our own custom herbal stuff. So
Ooh, fun.
local flair. I think I got that lined up, which would be sweet. And then we'll just keep growing this sucker. I'm enjoying the crap out of it. I don't know. Amy gets stuck doing it all the time. And then Sadie sometimes likes me. So but I think it's gonna be cool. Like as people keep responding to us, like after this, we keep growing a little bit each time on like just the knowledge. So I'm excited. I think the next time will be positive mental attitude. And then
That'll be good.
Ryan is automatically he wants to be on the thing, so I gotta have him. That's right. That
I
will
think
be
it's great.
I think it'll be fantastic. So that will be super fun. Cool. Well, you guys enjoy your night.
All right. See you
Have
later.
a good-
You too.
yes, have a good one. Take it
Bye.
easy. Bye, Sadie. You smiled. I saw you.